So the fourth treatment option for erectile dysfunction is in-clinic shockwave therapy. And before I jump into that, one of the key reasons that most men have erectile dysfunction is something called microplaque in the blood vessels. Unfortunately, part of our lifestyle, our diets, and sometimes lack of exercise can contribute to this buildup of plaque starting at a very young age. And this microplaque accumulates over time and gets thicker and thicker over the years and makes it so we have less and less blood flow in the area we were looking for blood flow to get an erection. And so by doing in-office, in-clinic shockwave therapy once a week, what that does is it uses shock waves, and the clinical term for that is low-intensity extracorporeal shockwave therapy, which is a sound wave administered to the penis and surrounding tissue that breaks up that plaque, breaks up that microplaque. It also stimulates new blood vessel growth. And if you realize that the lack of blood flow is the reason you're not getting the erection, if you're A, increasing blood flow by cleaning out the existing blood vessels, and B, bringing in reinforcements with new blood vessel growth, that's the reason it's so successful for guys in office, in clinic. So the pros of in-clinic shockwave therapy are many. Number one, there's no side effects, no downtime. Guys can have sex the same day they have treatment in the office. Another thing, and I get this question a lot, is so what happens to this microplaque that is, getting sound waves blasted, and where does it go? The good news is the body safely processes it out through the kidneys. You urinate it out. The same process that would happen if you gained a bunch of weight and lost a bunch of weight. Your body is very smart and it knows how to get rid of this stuff. So by the sound waves being administered once a week, it's slowly over time getting rid of this plaque. And of course, the other benefit is it's creating that new blood vessel growth. Another great benefit to in-clinic treatments, guys usually come in once a week for a number of weeks. So every week that you come in, you're getting the benefit of a one-on-one with a trained professional provider who is, customizing your treatment protocol along the way with what's best for you to get you, faster, safer, better results over that period of time. So now I want to talk about the cons of doing in-clinic shockwave therapy. Quite honestly, there aren't many, other than the fact that you do need to physically drive into the clinic once a week. But again, that's not forever. So some people could consider that a con. The other is insurance companies don't typically pay for what we do. So it is something that you are responsible for paying out of pocket. Other than that, we do work with a lot of guys to help diagnose what is the core reason they're having erectile dysfunction to begin with, in which case, if shockwave therapy isn't the main thing you need to be doing, of course, you're going to have that conversation with the provider anyway. There are other things, whether that's a hormone imbalance or something going on with the brain, PTSD and various things like that. But working with us, we are help to overcome those problems as well. But yeah, the main two cons would be actually physically having to go into the office and that insurance isn't paying for it.
This is a disclaimer that we do offer shockwave therapy treatments here at the Novus Center, as well as the rest of the treatments we will be talking about for the treatment of erectile dysfunction.
So as a regenerative medicine clinic, we focus on working with the body to help you do what you should be doing in the first place. We don't recommend things like trimix or surgery, as of course, those are very aggressive ways to force the body to do something that it's not doing on its own. We'd prefer to work with the body, via shockwave and all the other things that we're going to go over here in more detail to help the body do what it should be doing in the first place.
And as always, please speak with your medical professional before looking to start any new medical treatments.